The first session today is on infertility in Ayurvedic perspective and its Ayurvedic management by Dr. Wahida Rahman.
In the name of God Almighty, with the blessings of all my gurus from first letter to till now, a warm welcome to one and all. Guru Pada Padambhoja Paraga Vishadekshana Vandheda Chigilsa Tattvam Bishak Drishtya Vyakhyase Chitta Shuddhaye. Today's topic of discussion is diagnosis and management of infertility. This is the seminar related with spectrum of diseases causing infertility and various Ayurvedic management. We all know as a part of Ayurveda, we are Ayurveda students, practitioners and Ayurveda doctors. We have a rich science with us. We have so many opportunities to treat infertility, the spectrum of diseases, the state, the various avastha of the same situation and a different situation, etc. And also we know we have strength, like that we have some weakness also. That is, we do not have any artificial reproductive techniques to include in our treatment, but we can prepare the patient for if they needed artificial infertility treatment for their successful pregnancy, for their further management. That is, there are so many patients having tubal block and they already cut their tubes or ligature or tubes are done. They need the artificial reproductive techniques. Before starting the artificial reproductive technique, if we prepare them with our Ayurveda, the success rate is more and more high. You know, as a practitioners, there are so many cases. That is 3 times or 4 times IVF, there is no success cases. But when they are prepared with Ayurveda before doing that artificial techniques, then the success rate is more. So even with a pure Ayurvedic management, we can treat so many cases, and with support, that is preparing the womb for conception and preparing both male and female for the conception, we can do wonders in the world. So love Ayurveda, learn Ayurveda and come to the class. Let the dream come true. With the help of our powerful Ayurveda, we can have the opportunity that the dream come true. For every woman, the dream is to be a mother. So, what is infertility? Infertility is inability to conceive after 1 year of unprotected coitus. It is a definition seen in the modern textbook. But what is the infertility according to Ayurveda? Ayurveda, Acharya Harida says that Vandyasya Shat Pragarena Balena Vapyadava Punaha Garbhagoshasya Bhangat Mridavalsa etc. There are 6 types of infertility. Not at least giving a pregnancy or not conceiving is the term of infertility. Do not have a live child. Even though they are pregnant earlier, if they don't have a live child, it is known as infertility according to Ayurveda. So we can treat that all that spectrum under the spectrum of infertility or subfertility management. We can treat the pure infertility, that is the infertile, and it is, we all know it is asadhya. But the subfertility, there are spectrum of diseases and avasthas under the subfertility category. We can treat with Ayurveda. That is Garbhasravi Vandya, Mridavalsa, Janmavandya, etc. We can treat with Ayurveda. If the Janmavandya is related with only the chromosomal factors, that is some having Mayer-Rokitansky cluster Hughes syndrome, MRKOH, you well know, and like that it is asadhya. Otherwise, we can manage with our disease. And the hypogonadotropic hypogonadism is a one condition. There is resulting in the infertility. If the gonadotrophins are reacting with our medicine, then only we can treat. Otherwise, this also ending in the asadhya cases. After 1 year, if there is no conception, it is termed as infertility, and it affects 10 to 15 case of couples, 15% of couples. Chance of conception at 12 months is 80% and chance of conception at 18 months is 90%. So, coming to the factors essential for Garbhapati. We all know, we are Ayurvedic doctors, the factors, essential factors for Garbhapati. That factors consist in our treatment field. That the factors are Dhruvam Chadurnam Sanidhyat Garbha Syat Vidhi Purvagaha. Please mind, Garbha Syat Vidhi Purvagaha. Vidhi Purvagaha is the important factor. No, it is not a factor, but keep in mind. And Ridu Kshetra Ambu Bijanam Samarthya Danguro Eda. The Ridu means the period near ovulation, and Kshetra means healthy Garbhashya. Healthy Garbhashya means healthy uterus, healthy tubes, healthy vagina, etc. And Ambu, the nutrition, the proper nutrition. It includes all the nutritive factors, including the AMH. We know what is the AMH, anti-Mullerian hormone. It is not the nutritive factor, but it is including in the nutritive factors, because if the AMH is low, there is low fertility. Then if the AMH is low, AMH means it denotes the ovarian reserve for fertility. If the AMH is low, we can select donor egg. But when we transfer the zygote into the womb, if the low AMH, there is no fertility, because for the nutrition of the first section, that is from the day of itself conception and up to the formation of placenta, that is 3 months, the baby inside the womb grows by Madhuscha Ubasneha Ubasvedabhyam Kucho Vivardhade. What's the Ubasneha Ubasvedabhyam? There is some osmotic pressure, there is some give and take with the good choriodecidual reaction. That denotes the Ubasneha Ubasvedabhyam, which also implies a good AMH will help for the good fertility. So the nutrition under this also included the nutrition and the AMH level also. And the bija, ovum and sperm, both pumbija and stray bija. We know Vadadi Kunabhagrandi Puyakshina Malahayam bija Samartham Redo Asram. So the pumbija and stray bija are devoid of all the doshas, and they are in good quality and good quantity, etc. Then Acharya Vagbhada extends that Shuddhe Garbhashe Marge, where the Shuddhe Garbhashe Marge means Shuddhe Yoni, Shuddha fallopian tube, that is a Shuddha Garbhashe Marga, etc. And there is no infection, there should be no adhesions, there is good tubal motility, that is there is no flimsy adhesions, etc. That denotes the Shuddhe Garbhashe Marge. And Shuddhe Rekte. Next line is Shuddhe Garbhashe Marge Rekte Shukle Anile Hridi. Shuddhe Rekte means our blood is devoid of any doshas. That is because the Garbhasravi Vandhya, Mridavalsa, etc. are resultant with some Jadaharnis inside our blood. That is Jadaharnis inside our blood. What are they? The antibodies. That is anti-cardiolipin antibody, anti-phospholipid antibody, lupus anticoagulant, and torch infections. All these Jadaharnis inside our blood, inside the female blood, does not cause any disease or any fever or headache to the lady. When they will become active, when the lady get pregnant, they become active and they kill the babies. That is, it is the antibodies. That is our concept of ama is there. That is self-intoxication in our blood. Self-intoxication in our blood is also its reason for infertility or subfertility. So, Shuddhe Rekte is also essential. So, before giving medicine for the conception, you should assure that your patient is having Shuddha Garbhashe Marga, Shuddha Rekta, etc. for the proper fulfillment of the treatment, for proper result of the treatment. Then, coming to the Charak Samhita, Avyabanna Yonau Anubahadayam Apradushta Garbhashaya. He says that Avyabanna Yonau, including all these factors, Anubahadayam, Apradushta Garbhashaya, etc. There are so many methods for ovulation and taking male gamete, etc. But for the Apradushta Garbhashaya, the mother is from the Ayurvedic side. That we can prepare the womb for conception. If even there is an endometriotic uterus or adenomyotic uterus, with our Ayurvedic medicine, we can prepare the womb for the reception of the fetus. Otherwise, the only hormonal injection and hormonal therapies, they will help either ovulation or like that. We can only prepare the womb for fertilization. And coming to the Nidana of Vandyatva, Yoni Pradoshat, Manaso Abhidabat, Shukrasa Gahara Vihara Doshat. Nasrub Dosha, Asa Nubadrava of Yoni Yoga. we know the Upadrava of Yoni Roga. What says the Upadrava of Yoni Rogas? Imshadar, Vyabadar, Yoni, etc. What is the Upadrava? What are the Upadravas? Tado Garbham na Grihnadi, Rogam Stapnodi Darunan, Asrdara Arsho Gulmadi Nabadam Staniladi Bihi. That is the Upadrava of Yoni Ragos. Tado Garbham na Grihnadi. First Upadrava is Garbham na Grihnadi, Rogam Stapnodi Darunan. So, any Yoni Roga if there, you have to treat first for that Yoni Roga, then proceed to the infertility management. And coming to the Garbhagosha Bhanga. Garbhagosha Bhanga, there are two types of Garbhagosha Bhanga. One is with the iatrogenic Garbhagosha Bhanga and other with the permanent genetic, that is Sahaja. Sahaja, as Charakajira says that Sahaja Rogas are incurable asadhya. But there are some, nowadays there are some ovarian failures and also hyperplastic uterus are seen with the injudicious administration of hormones. This is not the problem with the doctors. The patients, they know what tablets to take for inducing menstruation, what tablet to take for stopping of menstruation. Without any consultation, the patients, they take this tablet for inducing menstruation, this tablet for stopping of menstruation. If there is more and more bleeding, they took some Tranexa or like Meprate like tablet like that for stopping menstruation. If there is no menstruation, they took some other hormone tablet for inducing menstruation. That injudicious administration of hormones will result in the Garbhagosha Bhanga. That is, there is hypoplastic uterus. If we get the patient in the initial stage with a hypoplastic uterus, we can cure the patients with advising that not to take any hormone medicines further, and please stay there. If you are not menstruating more than 3 months, do not get tempered. Stay there and took our Ayurvedic medicine, and it will help to both prepare your uterus and also to produce your menstruation. That is why I took more than 1.5 years to treat a premature ovarian failure case to become menstruating. More than 1.5 years. By keeping assurance that do not take so much medicines there, because at that time she is only 23 years of age. She is having menstruation menarche at the 13 years and irregular periods. She start to take hormone pills injudiciously from 15 years always onwards. And up to 20 years there is bleeding, that is only withdrawal bleeding. After 20th year there is no menstruation. There is no menstruation. She came for Ayurveda treatment with no menstruation, that is, and all her parameters, FSH, LH are so high, that is with the menopause level. Like that she came to take the Ayurvedic medicine, and initially keeping best advice, and also even medicines are not enough for treating with Ayurveda. Medicines with Pathya Ahara and Pathya Vihara and good mental effort is essential for treating Ayurveda like this case. And advising that avoid all fatty, salty, fried items, junk food, etc. Take our Artava Janaga drugs like Kulatta, Dedi, etc. And also the Kulathari Kashaya, Hingutriganadaila, and Shatapushpa, etc. to induce menstruation like that. And Misi Churna. Misi is one of the magic drug in my practice. The one of the magic drug, that is the Misi. I will show later. And that drug help her to regain her menstruation after 1.5 years. And after 4 months, advised to become married. And after 4 months, she get pregnant and now with a baby. So, even the premature ovarian failure case, we can treat judiciously. But if the case we are getting after 10 years of ovarian failure, then we can't do anything. It become asadhya. That is, all the ovarian tissues may be disappear. There is atrophic ovaries, there may be disappear. Like that. So, Garbhagosha Bhanga, if we are getting in the some initial stage, we can treat. And also, hypoplastic uterus, we can treat with our Sugumarangashaya. And there is one slogan in our basic principles, that is Vriddhi Samane Sarvesha. So, taking Samana Bhava Dravya, that is the goat uterus. Goat uterus, Shatapushpa, Devadaru, and then Pipali. We can make as Vasa, and give the lady with a hypoplastic uterus if they are taking Mamsahara, etc. And 3 or 4 months giving, and after that the scan results normal size of uterus. So Vriddhi Samane Sarvesham, we can take this also. This is read from all the Ayurvedic books from the Kerala, Anubhava like that. And you by taking all the even single tip from that in our practice, it seems more effective. And coming to the infertility and STDs, lack of safe sex practices increases risk of STD. About 3 million adolescent girls contract STD annually. Untreated PID will result negative impact on fertility, especially the tubal infertility. And STD affects DNA damage in sperm also, and thereby causing infertility or defective sperm, defective conception. And infertility and aging. Nowadays, we postpone the marriage life. That is due to study, MD, job. After that, we are preparing for the fertility. It also causes one factor for the good fertility time is over. So pregnancy rates are at peak between 25 to 30 years, begins to decline after 30 years. 75% of women less than 30 years conceive within 1 year, and only 44% at 40 years. My oldest infertility patient is 45. After that, I can't get any result. Infertility and aging. For male, aging reduces sperm count and adversely affect the quality of the sperms. Erectile dysfunction and reduced libido also due to aging is one of the cause. Infertility and aging in both male and female, aging produces comorbid conditions like hypertension, diabetes become prevalent, as does obesity. Obese women 2.7 times likely to be infertile. So obesity is one of the cause for subfertility. So if the patient is obese, do the Abhadarpana Chikitsa initially before doing the conception treatment. Infertility and stress, that is busy daily routine, modern lifestyle imperatives, shift of work, work-related travel, need for both couples to work, force them to postpone the infertility management till an age when help is impossible. And infertility and stress, which cycle stress can lead to problems with a relationship and other sexual problems. As our Acharya says that, Saumanasyam Garbhadaranam Shreshtam. So, the patients came to us with a lot of investigation report and lot of worries in their mind. So, initially pacify them, teach them and advise them. Then Dhidhairyatmadi Vijnana is Manodosha Aushadamaram. We only the Ayurvedic physicians can give the Dhidhairyatmadi Vijnana along with our management. These are some textual causes, that is infertility causes. That is when the couples go for one marriage function or one housewarming function, etc. After 1 year or 2 years of married life, every people ask, what are the problem? How many children? Who's the problem? Or male or female? Are you taking any treatment? There are no answer. Then for both male and female, there is 30%. That is equal. And combined is 10% and unexplained 25%. That is the unexplained causes. It is said in our classics, that is Devada. Devada is 25%. There are so many cases. Both male and female, there is no problem. Everything, what are the investigation reports, everything, both male factors are normal, female factors are normal, every scan results normal, every blood results normal, but there is no fertility. That is, the first sloka said that, Garbha syat vidhi purvagaha. Vidhi is the Devada. That is the unexplained cause. We can't explain that. I have one couple of patients, that is, they are at the age of 25, they get married. After 3 years, there is no pregnancy. They went to modern doctor. They took all the treatment. There is no, all the tests, there is no defect. Then they advised to do coitus for 2 years and wait for 2 years. You are only 25 like that. And at the age of 30, after 5 years of coitus, they go, there is no children, then there is no conception, then they do IUI for 13 times. That's the 13th IUI. She got infection in the cervix, that is cauliflower angry cervix. She got infection. There is no pregnancy. I've stopped all the treatment for 1 year, and then they start for IVF. That is, there is no cause for infertility. Then they started treatment for IVF, and they do 6 IVF. A female can't withstand all injections etc. for the 6 IVF, but they take 6 IVF. Then only the result is 0. There is no fertility. At the age of 43, they came to see me. That is, they went to one temple, and there one patient with a baby came, and they told that give my number etc. They came to with our Ayurvedic management, and I told that there is no reason for the infertility, but God Almighty knows what the reason. And initially, I will prepare you to clean your body. That is, with these sort of medicines, injections, etc., your bodies are so many toxins, and I will prepare you with cleaning your body with some Ayurvedic medicines. And if God Almighty have the chance to give you a child, He will give. Then the lady and the man said that, "Ma'am, it is no problem, and we will follow you till menopause." We are so many. We have so many expectations. So we will follow you up to menopause. I think I told that, but I can't explain why you are become infertile. I can't explain. I think only the Devada, that is unexplained cause. We can never follow. We can never test the Jivatma Paramatma Sannivesha. That is in the Paramatma. Jivatma can have a chance to have the pregnant. That is from the Paramatma, the Jivatma should come. That Jivatma Paramatma Sannivesha we can't investigate with any test. So do worship, that is do Ubavasa, weekly once do Ubavasa. According to your beliefs, weekly one Ubavasa, and you take some Yarvalaneta Yuni, that is Charula Dashapushpa. In Dashapushpa, one drug, Cherula, Bhadriga. Notice Bhadra, that is the Ervalaneta. That is Cherula milk decoction, Cherula and rice, rice gruel, milk gruel. You can prepare and take for that. Because by watching the surroundings, that is the animals like a cat, dog, etc., they can take the raw cherula when the time of fertilization. When the time of fertilization, they can take the raw drugs like cherula, this green like that. And I took the course because it is having some thing with the fertility. That's at the time of fertilization only the animals take that. So we are also an animal in the world. So we can take according to our like that. There's rice and milk and this cherula paste as a gruel for ending the Ubavasa, and no other food, just water, etc. And for once per week advice, and I advise the main thing said in the Veerasimha Avalokana, that is the Dana. Dana is the one important thing to cure the unexplained factors. That is, Dana means, Annadana is the most important. That is, one sloga is there, I will remember. Gejaduraga Sahasram Kogilam Kodidanam Kanagarajada Patram Medini Sagarandyam Udayakula Sahasram Kodiganya Pradhanam Nahi Nahi Behudanam Annadanal Savanam. So Annadana is one important thing. I advise this type of patients to do orphan care. That is, even their blood relation or the other in the surroundings, among the surroundings, do orphan care with the Dana. So they their expenditure with the treatment is more and more, and some of them some money from them should go to others. That is, the god in the temple or mosque, there is no need for any money. Only the Atma, needing Atma, we have to find that Atma and give them some money. That is, give something to their life. That is said in the Veerasimha Avalokana. If a couple is worried with Anabhya Dukkha, they can donate anathas. So advise that also. After 6 months, every month they will come to see me. There is menstruation, there is no problem, and they are getting more and more goodness in their health. That is now there is no edematous condition. There is some purification in the blood, and they come half an hour before appointment, and they sit there and see the babies coming and see the pregnant ladies coming, and they are getting more motivated like that. And after 7 months, I told that there is no need to come further, because you have 44 now, and your husband having 53 now, and everything, your body is always now it is clear without any so no need to come. Then they told that, never madam, we will come till menopause. Every month we will come till menopause. And after 7 months, that is 1 year and 2 months from treatment, they got conceived. Naturally they got conceived without any IUI, IVF. At the age of 44, she got conceived. And at the age of 45, she delivered with cesarean. That is, the doctor says that 45 is high risk for pregnancy, so they are not willing for waiting normal delivery. With the LSCS, they delivered a good baby. This is the resultant of Ayurveda Chikitsa with Dhidairyatmadi Vijnana, with Dana, with mental effect. There is no material thing. There is no material to any drug. It is all the cases, that's Manasiga, Devada cases, and the Jivatma Paramatma Sanivesha. If they are having any obstruction to that pathway, with Dana, that obstruction is going off. That is one of the main Chikitsa is also the Dana, especially the Annadana. Then, coming to the infertility management, when to investigate? After 18 months of unprotected coitus, 90% of women conceive. So, investigation is performed when 18 to 25 years after 2 years of regular unprotected coitus. When 25 to 35 years after 1 year. When more than 35 years, that is, there is some nakshatra in the Jataka, etc., their marriage will be advancing age. Then, after 6 months, should investigate. Guidelines for investigation: as infertility is a couple problem, both partners should be interviewed together. No one is to be blamed. Even we know if there is only female problem, only male problem, but we are the doctors. No one is to be blamed. We tell them that infertility is a problem of both. Both of you have some problem, even though there is no problem. No one is to be blamed. The clinician must acknowledge the couple's frustration and fear in there to have a child. Detailed general and reproductive history should be taken in the presence of both. Clinical examination of each partner should be carried out separately. Then, simplest, least invasive and most productive tests are completed first. That is, at the initial consultation, semen analysis and tests of ovulation are arranged. And Trivida, Chadurvida and Dasavida Parisha. That is, one lady came to me for good confinement. I means after conceiving, after getting conceiving with IUI like that, and she came to me for good pregnancy and delivery at the month of 4th month, and just touching her and feeling her nadi, you can feel there is something. There is so many hot. There is so many hot, and just palpating her abdomen, I think my hand is indwelling into that. That is, there is something. Then my mind says that please don't give any medicine. First give one ultrasound scan, then only give medicine. Otherwise, if there is any problem, they will blame that the Ayurveda is the problem. So, and I requested ultrasound scan. Then she came with the initial ultrasound scan at the 7th week only. There is no problem, just cardiac flicker is seen. Then on 4th month she came, advised an ultrasound scan, that is anencephalic condition. The resultant is the anencephalic fetus is that. I don't give any Ayurvedic medicine, but the result that anencephalic fetus inside the womb have that much heat, that much presence. We can feel with our Pratyaksha Pramana and the Darshana Sparshana, that is the Parshana, we can feel that like that. And the radiologist also wondered why I queried that it is an anencephalic condition. Then I told that, sir, I can feel something and I have the doubt that like it is only 10 lakhs, once in 10 lakhs, that's the condition. And they got MTP, and the modern doctor says that after MTP, there will be chance for the next pregnancy also this condition, so do not try for pregnancy. Like that, the patients came, the couples came, and I advised not to have any intercourse for 6 months. We need 6 months for purification for both of you, and advise Virejana for both after Sadhya Sneha. Then advise purificative methods like that. After 6 months, analyzing both male and female factors, then give preconception care for 3 months. Then give advice for fertility. After 1 year, she got pregnant, and there is no normal baby, no problem with that baby, normal baby. So that much purification and preparation can be done with Ayurveda. So our pramanas, that is Dashavida, Chadurveda, Parishas, etc., are very good for initial workup. A proper history and clinical examination of partners, detail of infertility, age of partners, type and duration, coital and detailed menstrual history should be taken. Any evidence of infection, previous pelvic surgery is very important. The evidence of infection is very important. Previous infertility management, etc., should be taken. In secondary infertility, previous obstetric history is very important. Coming to the physical examination, general height, weight and BMI, body habits, fat and hair distribution, oily skin, etc. Thyroid enlargement and its symptoms. We all know the thyroid dysfunction is also one of the subfertility causes. That if the body is rich with thyroid antibodies, that is anti-thyroid antibodies, TPO, thyroid peroxidase antibody, there is subfertility. Even though they become pregnant, there may be the first trimester abortion may be there. So if the case is with the thyroid toxicity, we have to reduce the toxins in her body. How we have to reduce? Is there any treatment for thyroid toxins? Is there any medicine for thyroid toxins? Just do our Amachigilsa. It's self-intoxication. Just do. There is a Vaishwanara Churna and Ashwagandha Churna. I take half teaspoon Vaishwanara Churna and half teaspoon Ashwagandha Churna with 1 glass hot water 15 minutes before twice daily for 3 months, and recheck the thyroid toxicity. It is markedly reducing. And their fertility also improving. That is Vaishwanara and Ashwagandha Churna. These are good source of antioxidants. These antioxidants will help to reduce the toxicity from the body. Development of secondary sexual characters, any breast discharge and abnormalities, etc. should be enquired. That is breast discharge. In Vandhyata, there is one thing that Vandhyanam Kshiranatyastu Vadena Paripurija Tasmat Kshiram cha Adhigam Bhavet. That denotes hyperprolactinemia leading to anovulation and infertility. The Acharya clearly says that Vandhyanam Kshiranatyastu Vadena Paripurida Tasmad Kshiram cha Adhigam Bhavet. Kshiram cha Adhigam Bhavet. Hyperprolactinemia leading to infertility. If a case coming with a hyperprolactinemia, then you should give the treatment for that first. That is, you can give some medicine. What are the medicine for hyperprolactinemia? Is there any direct menstruation, direct mentioning medicine that is which reducing hyperprolactinemia? But Acharya says all are sutra. In our Chikitsa, it says all are sutra. Virana Shali Shashtega, etc. Prayoda eva stanya jananam. Then Acharya says one thing for the tail. That is Prayoda eva stanya jananam. Siddhu Siddhartha Gadrde. Why Acharya says only Siddhu Siddhartha Gadrde? There are so many tracks in the world. Acharya take only Siddhu Siddhartha Gadrde. That is, Siddhu and Siddhartha are not Stanya Janana. And take that Siddhu and Siddhartha. Siddhu means Siddhu Madhya. We have some restriction to do that. And we take the Siddhartha, that is Sarshaba. Sarshaba Taila. Sarshaba Taila is effective in the reducing the hyperprolactinemia condition. If the hyperprolactinemia condition, it is best, that is below the 17 in the prolactin level is best for ovulation. If it is more 30, 35, etc., we can treat with our Sarshaba Taila, 10 ml Sarshaba Taila morning and evening according to the acne of that patient. We can give. Nowadays, there are some medicine we can also select the Dhanada Nayanadi Kashaya. Dhanada Nayanadi Kashaya. Are you remembering that Kashaya? Where it said? In Ardidam condition. Dhanada Nayana Shundi, Shigrasna Ugraganda, Varuna Reshuna Krishna, Chitra Gairanda Gaischa, Suradaru Kanabatya, Berberehi Sambradambaha, Shamayadi Paribidam, Sa Ardida Atsheba Vadan. Sa Ardida Atsheba Vadan. Here take the Atsheba Vada condition. Atsheba Vada means we know, but here the prolactin secretion is also like a pulsatile action. Atsheba, there is some Atsheba Vada involvement, pulsatile action. So took the Dhananayanadi Kashaya with Sarshabataila, it gives wonder result in the hyperprolactinemia condition of 76, 80, etc. If the prolactin level is more than 100, please don't treat with our Sarshabataila, just refer the patient to do pituitary analysis, that is to visualize the cell atoxicity with a CT or MRI to note any micro or macro adenoma in the thyroid. If there is any micro or macro adenoma, if there is any chance for malignancy, refer the patient for that management. If there is no chance for malignancy, just treat the patient with our Dhananayanadi, Varanadi, etc. It will get good result. Then coming to the systemic, to detect abnormalities like diabetes mellitus, hypertension, TB, organic heart diseases, chronic renal relation, endocrinopathies, etc. All these having some influence in the fertility management. Coming to the pelvic examination, approach should be systemic, thorough, calm and relaxed. Told not to have intercourse, douche or tampons for at least 24 hours before examination, because it will give some false result. 24 hours before examination, if they having like anything like that, they will mislead our result. Ask to empty her bladder before examination. And common cause of infertility for female is ovarian cause, tubal cause, uterine, pelvic and unexplained causes. And ovarian factors from the chronological order, you can treat the upper factors, and towards the lower it will become more complicated. That is anovulation or oligo-ovulation, we can treat with our ovulatory medicines like Tilakwada, Kridaguda, Vyoshabharni, Rejonida, etc. etc. Luteal phase defect, luteinized unruptured follicle, premature ovarian failure, and chronic ophoritis, chocolate cyst, ovarian tumor, that is become more complicated and needs at the Dhanandare Chikitsa. Clue for working diagnosis, amenorrhea and irregular menstruation points out anovulatory infertility. HSG shows tubal block, leads tubal factor. Here the first one is hydrosalpinx. Here both the tubes are swollen with a fluid, hydrosalpinx, and resultant in a low tubal motility and maybe either infertility or ectopic pregnancy. And the second one is large myoma in the fundus. Normally the HSG, the triangular shape is the uterus. Here the large myoma in the fundus the uterus becomes crescent shape. And the third one, that is the normal HSG. Nowadays people came with all these reports. The third one is the normal HSG, that is a triangular shaped uterus. Both fallopian tubes can be visualized, and the Langali Pushpa Sadrisha thing is that free spill of fallopian tubes. There is no adhesions, no flimsy adhesion in the fallopian tube. That is the free spill of fallopian tube. That is, there is no tubal occlusion like that. Then clue for working diagnosis, clinical examination and UHC reveals endometriosis, chronic PID, uterine fibroids, congenital defects, etc. And role of PCT and assessment of cervical factors is controversial nowadays. Initially there are so many cases with the post-coital test. Nowadays it is controversial. There is no need to do the post-coital test. Clue for working diagnosis, abnormal semen analysis, male factor infertility, and if all the tests are normal, become unexplained infertility. Coming to the ovulatory dysfunction, accounts 30 to 40% of female infertility. Most easily treated cause is the ovulatory dysfunction. The first thing is PCOS. PCOS resulting in oligo-ovulation or anovulation, hypothalamic amenorrhea, hyperprolactinemia. These all are ovulatory dysfunction. Other endocrinopathies, hypogonadotrophy, hypogonadism, ovarian failure, decreased ovarian reserve. These all the things are related with the ovulatory dysfunction. We can treat this thing according to the chronological order. Then documentation of ovulation, clinical methods. We know the ovulation pain, that is mitral smash at the time of mid-cycle spotting or some pain is there, but it is not specific. That is every women does not feel that mitral smash. It is not specific. Basal body temperature, there is daily monitoring before getting up from bed. A 0.5 degrees Celsius over the baseline lasts for 10 days for the ovulation. That is serum LH level. LH level is peak at 80 to 20 hours before ovulation, detected for 12 hours only. If we wish to test the LH level of that patient, if it is sufficient for ovulation, do the test on the 11th or 12th day. LH test. If we know, if you want to know it is sufficient for ovulation, do the test for 11th or 12th day. And serum progesterone. Progesterone is good for fertilization. So, if there is any progesteronic defect, there is no fertilization or there is defective fertilization. If we want to know the progesterone level for that lady, do the test on the 21st day. 21st day is the peak of progesterone level, 21st to 23rd day. Then USG monitoring, visualization of dominant follicle and monitoring it until ovulation takes place. At this time, the size of the follicles decreases and fluid appears in the cul-de-sac. Ovulation occurs when dominant follicle is about 17 to 25 millimeter. Endometrial thickness 6 millimeter or more. Please note, the endometrium is the bed for conception. It is essential for conception. The endometrial thickness should be 6 millimeter or more. Trilaminar in appearance, preferably 8 to 10 millimeter, and trilaminar in appearance. If it is less than 4 millimeter, there is defective conception. If it is more than 14 millimeter, there is no proper conception. Otherwise, there is defective conception. So, 8 to 10 millimeter and trilaminar in appearance is advisable. Hormone test, FSH, LS, serum testosterone, etc., TSH, prolactin and AMH. We know for the fertility thing, if you want to do the hormone test, please do on the second day. Second day of menstruation, we can do all these tests to know whether the state is fertilization, whether they are capable of normal fertility, etc. And if we want to do know the LH peak 12th day, want to do the progesterone peak on the 21st or 22nd day. Normal thing on the 12th, second day of periods. AMH, irrespective of days, we can test. Documentation of ovulation, tuboperitoneal factor 30 to 40 percentage case for infertility, and tubal factor like PID, pelvic inflammatory disease, TB. Sperm remains alive for 48 to 72 hours in the most of the female tract. Cervix acts as a reservoir of sperms. So conception can occur after sexual relation. Even ovulation occurs in 2 to 3 days. So advise the patient to do the coitus between the 10th to 20th day, alternate days. It is enough. This is a normal fertilization. I am moving fast because time is now less time is there. Adhesion due to endometriosis. That is, endometriosis is one of the main cause for infertility, because in the endometriosis case there is some distortion of the tubes, distortion of the endometrium, and also there is some adhesions is there. It is resulting in infertility. We can treat the endometriosis case with the Nirgundyadi Kashaya, Gobichandhanadi Gulika in the morning and going fast. So Gumaran Kashaya and Hingutrana Daila in the evening. Hingutrana Daila is one of the best cause for best treatment for the what is this adhesional lysis. Hingutrana Daila is best adhesional lysis drug in our classics. And Gulgulu Panchabala Churna here, it is Gedikna, Kushtakna, Kushta Bhagandara Gulma Gedikna. Is all thing is related with the endometriosis. Please read that thing more. And then adenomyosis. Adenomyosis also resulting in ectopic endometrial tissue in the myometrium. Lay down poor endometrial support for a pregnancy. And endometrial polyp, which is also giving poor endometrial support for pregnancy. And uterine fibroids. That is the fibroid, the subserous fibroid do nothing. Small subserous fibroids we can avoid, but intramural fibroids and intracavitary fibroids and submucous fibroids, these all are related with the infertility issues and problems. And also the submucous fibroid, and then just beneath the endometrium, they have more chance for getting malignancy and also infertility, and also there is resulting in the abortion. Then endometrial adhesion due to previous endometrial hyperplasia, that is DNC, like there is endometrial adhesion. In that condition, there is no passage of the sperm into the cavity and into the fallopian tube for fertilization. It also resulting in the infertility. We can treat with the Charadaila, Narana Taila, etc. For Uttaravasti. Then male factor, only 20% is case. Coming to the male factor, male cause defective spermatogenesis, obstruction to the efferent duct system, failure to deposit sperm high in vagina, errors in the seminal fluid. Defective spermatogenesis, congenital cause, undescended penis and orchitis, pubertal mumps, genetic cause, testicular toxins and endocervical, varicocele and tumors, primary testicular failure. In this case, we can't treat the primary testicular failure, genetic factor, etc. But and the pubertal mumps, we can treat after that. So we can treat only something in this part. Obstruction of efferent duct system, congenital. If there is Young syndrome, that is absence of wax differences, we can treat that case. We can help them to produce sperm inside the testis, and we can assist them to take the sperm from with artificial techniques and like TESA like that, and they can do the fertility management. And Vidava Marmafikada is one of our in the classics said in the Shandada. And failure to deposit sperm high in vagina, this is the hypospadias condition. We know normal urethral opening is in the tip of the penis, but the opening may be in this defect level, in the anatomical defect, that is the hypospadias. In this condition, there is defective in the deposition of the sperm high in vagina. It also leads to infertility. Infertility, varicocele is the most common cause, and we can treat with our Chirivilluadi Kashaya, and we can treat with some medicines like Itchuradi Lehia, Chirivilluadi Kashaya, etc. Varicocele we can very well treat. And Ullivattadagadi Kashaya is one of the Malayalam Kashayas that is in the Sahasra Yoga. That is Ullivattadagu Chukkurinjave Avanakkinude Ver Kashayamai Avanakuruvin Ennasa Indavo Neer Kudikil Vishanam Chunduvu. So one of Malayalam Kashaya refers Sahasra Yoga. Then cause for ED, neurogenic, psychogenic, trauma, IVD lesion, diabetes mellitus, multiple sclerosis, alcohol, pelvic surgery, spina bifida, etc. We can advise not to have alcohol, and we can treat them with the diabetic management, etc. to reduce the erectile dysfunction. ED means erectile dysfunction. Erectile dysfunction, nowadays we have one medicine, that is no block ED. One medicine is available in the market, in the Ayurveda market. It is very, very good for the treatment of this one. I think it is one patent drug, but it is good for treatment of ED. Then investigations and findings. Semen analysis provides health index of male in respect of about 90 days duration. And I am skipping all these things. This is the defective. First one is the normal sperm. Second one is giant sperm, micro sperm, double head, twin head, etc. All these spermatic means anatomical defects will lead to infertility or subfertility. This can be treated with our Ayurveda with most of the antioxidant management like Purana Datri Phala Churna, Ashwagandha Churna with Kalyanam Grida and honey, and one thing, that is the Datri juice, Nellika juice, Datri juice, 4 Nellika juice, for mix up one juice and the 7 p.m. We can treat the teratolozoospermia with our medicine. Initially give Virejana, then give our antioxidant therapies like that. Normozoospermia, all sperm parameters are normal. If defect, there is condition. Coming to the management, Purva Karma, Sneha Sveda, and Shodhana Karma, Vamanadi Karma, for Vada and Lamana, Belya, Shuklagaravasti, Patyahara with Belya, Jivaniya, Shukla Drevyas, etc. Then Shukradushti evaluation, Shodhana, Snehabana, Svedana, Vamana if needed. Mainly the Chikilsaya Pradhanam, Avasthani Vidhanam. Take the Avastha of the patient, take the Avastha of the Agni, etc. We can do the proper treatment. That is Tatra Alpe Langhanam Patyam, Mathye Langhana Bhajanam, Prabhude Shodhanam Dhathi Mula Dunmulayet Malan. That is the underlying principle. Then now coming to the drugs, Lakshmana. Lakshmana is one of the drug for fertility, and Shatapushpa, Kumari, Vadasanga, Sugumarathrada, Varasatpis, etc. Then this is my magic drug which gives more result in my treatment. now with 2,127 babies with Ayurveda Chikitsa, with most of them with this drug, that is with Shatapushpa. And this drug, do you know this drug? This is the Bhandari. This means the clerodendron. Oriveran in Malayalam, Bhandari. This is a clerodendron. This drug is also having good fallopian tube cleansing effect. That is, if there is any flimsy adhesion, if there is any hydrosalpination, etc., we advise this Bhandari milk decoction for the management. For 3 months we given prior to conception, and in pre-conception care we given this milk decoction from the day 6 to day 14. Then other medicine from the day 10 to like Balasarpis and Pushpe Bidam Bhalayat, Balasarpis, etc. we advise after day 10. Stress management and yoga, there is Pathya, and please avoid this broiler chicken, avoid by doctors and our patients, etc. It is big for growth, 17 beta estradiol, progesterone, etc. are there, tetracycline, streptomycin, etc. are there. It will hamper our treatment and hamper all the hormonal effects. And anabolic steroids reduce the testosterone count, which also result in there is six-pack muscle, but there is an infertility. Then there is 2 case. I skipping that, and I will give the all the. Can you interesting in the case study? Yes, a couple of lady of 42 years and her husband 49 years having complaint of infertility came to our dispensary with a bundle of investigation reports of 20 years, going through some ovulatory dysfunction. Endometrial thickness is 1.3, it is very less, and on the 13th day asthenospermia with increased liquefaction time, etc. are noted. Previous 18 months no medication. First counseling done, frustrated lady having irregular periods from 13 years, menstrual history 2 to 3 days spotting, streaks in 35 to 60 minutes or 60 days or more, like that. And lean patient, that is lean PCOD, PCOS on UST. She is a lean PCOD. We think PCOD is both obese and lean, and obese PCOD is easily treatable. That is Avadarpana Chikitsa is needed, only that. Lean PCOD is much struggle to treat. Then semen analysis, volume 1 to 2 ml, liquefaction time more than 4 hours. Liquefaction time within 30 minutes or 1 hour is good for fertility. More than 4 hours, that is the seminal fluid, that is the protein inside the seminal fluid get denatured. That is why the liquefaction time is more. That the seminal fluid is essential for the food to the sperm. That if it is not getting liquefied within the 30 minutes or 1 hour, the all the sperm, there are millions of sperm, more than 100 millions of sperm there. All the sperms get damaged or get destroyed after 1 hour. And total sperm count only 5 million. Actually motile only 3%. Vessels 25 to 30. Like here, oligo, astheno, teratospermia is there. And treatment given for female. Garbhashe Shodhanatham Dashamulanja Nalinam Sprikaye and Dashipascha Payelcha Payas Quadha Garbhashe Vishuddhaye. Garbhashe Shodhanatham Dashamulanja Nalinam Sprikaye and Dashipascha. Dashamulam Nalinam Sprika Eranda Shipa. And Payelcha Payak Quadha Garbhashe Vishuddhaye said in Arogya Raksha Kalpadruma, Vaidya Daraga, etc. There are some Malayalam textbooks. And Elaganadi Kashayam with the Dhanandaran Guliga twice daily. Why I give Elaganadi Kashaya to this patient? Taking history, it is evident that she is having 1 episode of TB there. That is why I think the thin endometrium is resultant with that. That is, endometrium is resultant with the ojas, and TB also. Rajeshma is ojas reducing factor, and I prescribe Elaganadi Kashaya with the Dhanandaran Guliga. Then Agastya Rasayana and Dashamula Rasayana to put on ojas. Dhanandaram Abhyangam and Avagaham. Then advice on next menstruation. For female, Virejanam with Avipati Churna, Kalyanam Kashaya, Chirivilvadi Kashaya, Sugumaran Grada, Spiman tablet, I think it from Himalaya, and Chandraprabha Guliga, Suranavaleha, and Belastro Gendai Thaila local application, and Puyahara. This is Puyahara means there is no so much struck. In the Ashtanga Hridaya, it is said that Payam Kunaba Puyasre Chandanam Vakshide to earth. So, in the Shukradushti evaluation, Kunaba Puyasre Chandana, Ramacha, and that is Ushira, Chandana, Ushira, Shariba, Musali, and the Trigandaga. These 5 drugs in a mixed form we are calling as Puyahara Dravyas. Puyahara Dravyas we are giving all the pyospermia patients. Chandana, Ushira, Shariba, Musali, and Trigandaga. Next with second day of menstruation treatment, Shadapushpa powder with Indugandham Gradam in the initial stage, then Kalyanam with the Kalyana Gradam, then 6th cycle, there is no conception till the 6th cycle, then we are doing for the follicular study, then 10 millimeter follicle on day 13, 11 millimeter follicle on day 15, 12 on day 17, 13 on day 21, 14 millimeter 23, 14, 25, 14, 27. That is till day 27 there is no ovulation. All the ovum is developed only up to 14 millimeter. There is no further development and there is no ovulation, resulting in luteinized unruptured follicle. Then Tilakwadu Krida Guda Vyosha Bharni Rajonida for ovulation, menstruation on 39th day. Then male evaluation after 3 months, volume 3 to 4 ml, liquefaction time within 60 minutes, and a total sperm count 34 million, actively motile 37%. After 3 months, from 5 million, 34 million is there, 4 hours, 60 minutes is there, and actively motile 37%, sluggish 31, and pulses 47. From that much pulses, it is reduced to 47. Then medicines for male, Sugumara Grada, Spimat, Vigomax, Vyoshadi Vadaga. Vyoshadi Vadaga said in the Kasa Chilsa like that, Vyoshadi Vadaga with the hot water, we can give the patient to regularize the liquefaction time. This is a blood thinning agent. That is, blood thinning agents will help to reduce the heat inside that blood and reduce the heat. The heat is the reason for the increased liquefaction time, and which will help to reduce the liquefaction time. Surana Valeha and Bringarajasvan Chandanasava. Then for female, Kalyana Vashaya with Gruda, Shadapushpa, that is Aredasi, Alparedasi, Devobahada Chedasi. Aredasi, Alparedasi is Kalyanagra, so Kalyana Vashaya with Gruda, Shadapushpa and Sugumara Gruda. Then for first 10 days, Shadapushpa and Pulinga for next 10 days, and ovulation monitored on the 17th day, advice given the same month they got pregnant. This is one other. This is our Malayalam prescription, our dispensary prescription. And a lady with a laparoscopic tubectomy and 1 tube is normal there, and also there is a severe endometriosis there. Then advised Nirgundyadi Kashaya, Gopichadanadi Guliga, Sugumaran Kashaya, Hingtruna Taila, Gulgulu Panchamala, and Dhanandaran Taila. And for male, Adizova, Spiman, etc. There is some defect is also. And Mahadanandaran Guliga after 3 months conceived that this is the result of that baby. And coming to the conclusion, moving fast in between something, that is a shortage of time. We can have enough time if you ask any question. Then towards the conclusion, though multiple factors are involved as a cause for infertility, the lifestyle, food habits, family history, occupational, and above all the psychosocial and marital relationship are found to be the major contributors in evaluating the fertility status. Contribution of Ayurveda is valuable in this junction. And at last, my sincere thanks to AVCRI for calling me as a faculty, and all the delegates for participating there, and for patient hearing. And my humble prayer is Sreyo Bhuyat Sagala Janana. And this is from the Ashtahridaya, that is Skalat Gamanam Avyakta Vajanam Dhulidosaram Abhilala Vrdamugam Hridayahladaganagram Abatyam Tulidam Kena Darshana Sravanadishu Kim Yunar Shodharma Jnana Sri Gulavardhanam. So love Ayurveda, learn Ayurveda, and live in Ayurveda. Every physician have got good result with Ayurveda. Thank you once again. Thank you all.
Thank you, ma'am. It was a wonderful session. Any questions from the delegates?
there is one mistake from my with my part. That is, I think that 9:30 a.m. to 11 a.m. it is a lecture time. That is why I prepared so elaborated this session. That is why I am going.
It's okay, ma'am.
Likely, if you priorly intimate that 1 hour is the lecture time, then I will prepare like that. That's no problem. But if you need the presentation, I will give you. You can circulate with the participants.
Okay, ma'am. Thank you.
Yes. Okay. The Nadi Parisha, there are so many things I can't know. I could not explain everything in the Nadi Parisha because I know only small thing in the Nadi Parisha, that is the Gati of the Nadi, etc. And while checking that patient, the Nadi, please be seated. There, the Gadi is more, that is Vada Gadi is there, but Ushna Sabhava perception, that is she is extremely hot, extremely Ushna, and when I palpate the abdomen, my hand is going inside. That is due to heavy Ushna. When I place my hand, it will reflect that like that. So I think that is if there is any condition like that, only the illusion I thought that there is anencephaly, then I refer the patient for scanning. The thing that why I refer the case for scanning, due to that extremely hot condition, Ushna condition, and the Gedi of the Nadi only. I can't explain all the Nadi Parisha because I know very little about Nadi Parisha, only small, but with experience, Abhyasyal Prapyade Drishti Karma Siddhi Pragash, Abhyasyal Prapyade Siddhi Karma Drishti Pragashni, Reknadi Sasanjal. By experience, we can find many things through Nadi Parisha. By experience, we can find, just do Nadi Parisha and just do the Darshana Sparshana Parisha for our patients. It will get more and more inference. Okay.
Any more questions?
Yes.
We are.
Ma'am, it was an enlightening session.
Thank you, ma'am.
See, if a couple come to us, know when is the best time to do the Panchakarma, or after how many months of treatment we should proceed with?
Dear doctor, every couple does not need Panchakarma. Initially, you have to evaluate the couple. If there is Prabhuda dosha, then do. That is Tatra Alpe Lenghanam Pathyam, Madhye Lenghana Bhajanam, and Prabhude Shodhanam Tadhi Mulad Unmulayet Malan. If there is Prabhuda dosha, that is almost all the condition came to us with Prabhuda dosha, with so many other treatment, etc. If the couples having that much condition, then we can do the Panchakarma. Then before doing that Panchakarma, if there is any dosha visitation, etc., we can give with some Shamana Aushadis. Then with the Virechana, we can prepare both them for Panchakarma management. Before doing Panchakarma, we can do Virechana for both of them with the Sabya Sneha and for Avibhati Churna for male and Sugumara Eranda for female. And then according to dosha state, we can take the Sneha Bana, Vamana or Virechana, what is necessary, we can take. Initially, when a patient came to our OPD, do not start Panchakarma initially. Just evaluate the patient, evaluate the condition, evaluate the doshas, evaluate the avastha. Then only do the treatment. If there is needed, definitely Panchakarma gives good result in the condition like the severe endometriosis condition, endometriosis adhesion is there. We can give Panchakarma and the Uttaravasti. Tadaha Sarvadaha Suvishuddhasya Sesham Karmaha Vidiyade. For female fertility management, Vasti Abhyanga Parishega, Preva Bijudaranam, etc. Sarvadaha Suvishuddhasya. After doing Panchakarma, we can do that Uttaravasti, etc. for the proper management. So, evaluate the patient initially.
Ma'am, which is the best time to do Uttaravasti? Is it just before the ovulation period or after the menstrual cycle?
Both are the same. After the menstrual cycle is the before the ovulation period. We are preferring the Uttaravasti just after the menstruation, that is after 7th day of menstruation. 3 or 4th day there is a menstruation, something that is after 7th day there is no menstruation. After 7th day, before 14th day we are doing Uttaravasti. And for how many cycles we can do this? 3 cycles we are doing there only. And then advising. If the patient has less time and there is less amount of needed, then only 1 cycle we can do the 3 to 4 Uttaravastis in 1 cycle and advise them to for conception. Yes.
Any experience with essential hypertension? Best of you know we have a few set of patients. Whenever we take them for examination table, the BP shoots up to 170, 100, and I cannot do Uttaravasti. So, any suggestions for that, please?
I have no experience like that, but we can suggest something that the essential hypertension and some hypertension is, please be seated, ma'am. And some hypertension is there. We can treat with our Ashtavarga Kashaya and Yogaraja Gulika. It is good for treating hypertension rather than any medicine. And we please don't stop their hypertension drugs. And along with we can do with the Ashtavarga Kashaya. Ashtavarga, you know Ashtavarga Kashaya? Ashtavarga. Huh? Yes, Bela Sahajara Eranda, Shundi Rasna Suradrimahi Sasinduara Leshinei, Ashtavargo Anilabaha. Ashtavargo Anilabaha. This essential hypertension extra are the one of the Vada improving Vada vitiating condition. So Ashtavarga Kashaya with Yogaraja Gulika is best treatment for the hypertension management. Before giving before the Uttaravasti, you can give them this medicine for 3 months like that to reduce the hypertension, and then you can do the Uttaravasti. Okay. This is very good Kashaya for Ashtavarga Kashaya. It is the Ashtavarga Kashaya is good Avarana Vadahara Kashaya. Please keep in mind all the hypertensive things like that. There is some Avarana Vada is there. Avarana Vadahara treatment is effective in this management. Okay.
Thank you, ma'am.
Thank you.
Graves' disease is the cause for infertility in ladies, then what can be the line of treatment? I did not get success.
That is the thyroid dysfunction, is that? Okay. If, thyroid dysfunction is, ma'am, please sit. Okay. Thyroid dysfunction is there for infertility and for subfertility, etc. And when the thyroid antibodies are in more level and thyroid hormone is in the upper level, if their patients are taking modern medicine for thyroid management, hypothyroidism or hyperthyroidism management, please advise that medicine, because pregnancy needs double dose of thyroxine. Any Ayurvedic medicine can we can refer to give that much thyroxine at same time. So along with that medicine, we can have some medicines like Hamsapadhyadi Kashaya, Kanjanara Gulika, and Vaishwanara Churna. Vaishwanara Churna is one of the best method for treating thyroid. That is Vaishwanara. So Vaishwanara is Agni. So thyroid dysfunction, the Agni treatment is Yoga Sarvebi Mandekno. The Agni treatment is more. So Vaishwanara Churna, and also the Graves' disease is with the some antioxidant level is more in the body. So we can add on that the Ashwagandha Churna. Ashwagandha is our aphrodisiac Churna. Ashwagandha Churna with along with Vaishwanara Churna and Ashwagandha Churna. That is, I take half teaspoon each with 1 glass hot water 15 minutes before food twice daily for 3 months. Then evaluate the condition. There are so many symptomatic reduction is there, anti-thyroid antibodies reduced there, and so many edema, because in most of the hypothyroidism case there is mixed edema condition. The edema conditions are lowering the Angamarda state is also lowering with our this type of management. Then we can prepare them for fertility management. Then only it will effective. If we are doing only the pre-conception care for that patient without any this antioxidant therapy, etc., there is less result. If we are doing this therapy, then result. And madam, please keep in mind that is in thyroid dysfunction there is something more related with ama. That is ama. Ushmano Alpabeladhena Tadu Madhyam Abachidam Resamamashagadam is only the reference by Acharya initially. Then Acharya itself have an insight that next line he says that Anye Doshebhyo Evadi Dushtebhyo Yo Anya Manya Mudirede Kodravebhyo Vishaseva Vadandyamasi Sambhavam. That in self intoxication is that reason for this type of condition. And Pajane Dibane Snehestan Swedescha Parishkrudan Shode Shodanehi Kale Yadhasanna Medabalam. That is the line of treatment, ma'am. After that, we can do the fertility management. It will get result. Okay, ma'am. Thank you.
Thank you, ma'am.
Saptasaranga Bhagwadi Amma ma'am. Next, I think next speaker is Bhagwadi Amma ma'am. I respect ma'am as my mother also. That and she advised with that Saptasaranga Kashaya is definitely Saptasaranga Kashaya is also one of good Kashaya for it is that is Sapta Varshabu Villu Kalla Uribu Sahajara Shundi Akni Mandehi Kashaya Padavya Saptasaroyam Gunagana Padu Hingaja Yukter Edarham Vit Bendam Vanni Mandyam Rujamadi Mahadim Yoni Hrit Kutchi Prishtasroni Desheshu Sadyashamedi Jadarashtila Gulmanja Pleham. Here, Vitbandam, Vanni Mandyam, both are related with the thyroid toxicity, and Saptasaranga Kashaya is also one of the best line of treatment. Thank you.
Thank you, ma'am.